Hi and welcome to the pre-registration pharmacist programme for NHS Ayrshire Arran. My name is Scott McColgan-Smith and I am a senior pharmacist in prescribing development and education. The purpose of this presentation is to give you an insight into what we can offer you in Ayrshire Arran and to show you the many opportunities that lie ahead. First of all, a bit about us. As you can see from the map of Scotland, Ayrshire Arran sits on the west coast, lying south of NHS Greater Glasgow and Clyde and to the west of NHS Lanarkshire. Many of our workforce commute from Glasgow and the surrounding areas on a daily basis, including myself. We offer 6 pre-registration pharmacist places, 4 based at University Hospital Cross House near Kilmarnock and 2 based at University Hospital Ayr in Ayr. Of the 4 pre-registration pharmacists based at Cross House, 2 will undertake the new and exciting modular programme. This means that each trainee will spend 6 months in the hospital setting and 6 months in primary care, working between 2 or 3 GP practices. When applying for NHS Ayrshire Arran, simply apply for the hospital pre-registration programme, and once selected, the Health Board will be in touch with you to obtain your preference for either the full-time hospital programme or the modular programme. You'll become very familiar with our organisational values, caring, safe and respectful, which we strive for at all times. It won't take you long to realise that this is a great place to train and work. There are many hospitals within NHS Ayrshire Arran. Some are pictured here. We have our 2 main acute sites that I have already mentioned, but we also provide a pharmacy service to a number of rehabilitation hospitals and our small island hospitals on the Isle of Arran and Isle of Cumbrae. During your pre-registration training, you will mainly work between Cross House and Ayr, but we will also provide training at Woodland View Hospital, our mental health centre. The trainees very much enjoy the variety and the chance to experience different pharmacy environments and work with different teams throughout the Health Board. Training to become a pharmacist in Great Britain involves learning, understanding and demonstration of how to deliver the safe and effective patient-centred care which patients and the public expect from pharmacy professionals. To do this, you must complete the 52-week pre-registration pharmacy programme and fulfil 76 performance outcomes that must be signed off by your tutor. You must then also complete a GPHC registration assessment before registering as a fully qualified pharmacist, ready to take on your new role. Prior to starting with us, you will be assigned a pre-registration tutor who will guide you through the training year. We have excellent tutors in Ayrshire Arran and you will be very well supported throughout your year. You will meet with your tutor on a weekly basis to touch base and discuss your progress to date, and you will also complete a number of appraisals throughout the year that are sent to NES. Your tutor will ensure that you are able to achieve all of your performance outcomes and will also provide support and mentoring for the pre-registration final exam. We have an excellent track record within our health board and our pre-registration pharmacists really excel. Let's take a look at some of the areas you will be working and training in whilst you're here. Please also refer to the sample timetable that has been uploaded. This will give you a rough idea of the time spent in each area and how this is divided up throughout the year. Here is a list of some of the hospital pharmacy departments that you'll get experience in during your training year. I will now go through each one in turn and explain a bit more about what you might expect. I will start with clinical pharmacy, as this is an area where I often get asked the most questions about. Clinical pharmacists have a fundamental role in promoting patient safety and reducing the risk of patient harm. You will have the opportunity to work in many different clinical areas of the hospital. These include oncology and haematology, renal medicine, gastroenterology, endocrinology, medical admissions, general surgery, orthopaedics, and respiratory to name a few. As a result, you will train alongside many different specialist pharmacists who deliver expert pharmaceutical care to their patients in that area. You will be involved in tasks such as speaking to patients about their medicines, assessing compliance, educating patients on their medicines, performing medicines reconciliation, reviewing medicines using the electronic prescribing system, learning how to assess a patient's blood results, and discussing complex issues with members of the multidisciplinary team. You will also have to regularly use your problem-solving skills to deal with medicine-related issues and queries you are given. At the beginning of the training year, you will be heavily supervised and get the chance to observe many different areas of clinical pharmacy. As the year goes on and you develop your skills, you will be given more and more responsibility. Finally, towards the end of the year, you will be given your own ward to cover, with the security of having senior support available for you at all times. Trainees very much like this structured approach to the training year, and they feel it prepares them very well for life as a fully qualified pharmacist. Another key area of practice for your pre-registration year is training within the dispensary. You will work as part of a large team involving pharmacists, pharmacy technicians and pharmacy support workers. During your time here, you will learn everything about the dispensing process and will be able to prepare medicines for a large variety of inpatients and outpatients. You will learn how to clinically verify prescriptions that are received within the dispensary from doctors and non-medical prescribers. The vast majority of prescriptions received utilise the hospital electronic prescribing system, for which you will be given training and support from our excellent e-prescribing team. The prescriptions contain a lot more information than is available on a GP10 prescription received in the community setting, therefore a lot more is involved in the verification process. You will also regularly contact prescribers for more information and discuss changes to medications when you identify any errors, all the while ensuring that the process runs smoothly and that each patient is discharged from the hospital in a timely manner. Many of the medicines in the hospital dispensary will differ from those you might see in the community setting. We regularly deal with very specialist medicines that are often only used by very small patient groups. Some of the medicines can be unlicensed and others can be involved in clinical trials. We also have a patient consultation area that you will use to educate patients and their relatives on the correct use of their medicines to promote safety and efficacy. The dispensing process is robot assisted in Ayrshire Arran. These images were taken at University Hospital Cross House, but Ayr also uses robotic dispensing. Robotics helps reduce the risk of dispensing errors and improves efficiency. Another key part of your hospital-based pre-registration training is undergoing training within the aseptic suite. Whilst in this area you will work closely with the experienced aseptic dispensing team to provide intravenous and intrathecal chemotherapy, total parenteral nutrition, and other specialist items for patients within the hospital. You will learn the highly skilled process of producing these items by shadowing the team in action, followed by learning how to do it for yourself. You will also learn the strict checking processes that are in place, working closely with the responsible pharmacist for the unit. You will also learn to adopt the stringent measures that are in place to minimise the risk of microbial and particular contamination. As part of your training year, you will also spend some time training with our quality assurance team. This department has the responsibility to ensure that each medicine stored and used within the hospital is of the correct standard and quality. They also deal with unlicensed medicines that are received into the hospital, many of these coming from different countries from around the world. Another key role of the QA team is environmental monitoring, including fridge temperature monitoring and the testing of medical gases. The Medicines Information Department has a key role in responding to medicine-related inquiries from health professionals within the Health Board. These inquiries can be very complex and often have tight deadlines for you to respond. You will use a wide array of medical and pharmaceutical resources to formulate your response and communicate this to the prescriber, working closely with the head of the department. Our dedicated education and training team are involved in the training of staff from many different disciplines on various topics relating to medicines and prescribing. They will also help support you and your tutor throughout the pre-registration training year. They link with national education groups and with NES to ensure information and guidance is up to date and that you get the best out of your training year. Working alongside this team will give you the opportunity to undertake intra-professional learning. The current pre-registration pharmacists have received additional training alongside the medical students and junior doctors. This year we've also developed a multidisciplinary simulation programme that involved the pre-registration pharmacist training alongside 5th year medical students to treat patients with different health conditions. This really challenged the trainees but was hugely rewarding, and they learned a lot from the experience. This year we are introducing the new modular training programme starting in August 2020. Trainees will undertake a condensed 6-month programme in hospital and 6 months in primary care. As you can see from the table, the 2 trainees involved in this programme will swap halfway through the training year. If undertaking the modular programme, you will be assigned 2 tutors, one in hospital and one in primary care. They will work collaboratively to support you during your training year. The primary care team includes pharmacists, pharmacy technicians and pharmacy support workers who provide a service to all GPs in Ayrshire Arran. As a pre-registration trainee, you will work with practice teams to deliver the pharmacotherapy service outlined in the GMS contract, which includes speaking to patients about changes to their medicines after being in hospital or attending an outpatient clinic, as well as arranging appropriate monitoring. You will also be involved in a variety of prescribing improvement projects that are driven by health board priorities. The modular programme also provides the opportunity to spend time with pharmacists and pharmacy technicians who are part of the intermediate care team and the care at home pharmacy technician team. These pharmacists and technicians work closely with social care and other health professionals to help patients manage their medications at home. All pre-registration trainees will spend 4 weeks working in the community pharmacy setting to gain valuable experience in this sector. NHS Ayrshire Arran invests a lot of time and energy in their pre-registration pharmacists. Where possible, we try to retain our trainees within the health board after the training year is completed. We will support and encourage you to apply for vacancies when they arise. The slide shows the general career progression throughout the organisation. To progress in your career, we invest a lot in our pharmacists. Many of our pharmacists will undertake the foundation training programme once becoming shortly after registering. Many then go on to complete an MSc in Advanced Clinical Pharmacy and Independent Prescribing qualification. We also support the attendance of relevant conferences and training events. I hope you've enjoyed this presentation and that has given you a good insight into what you can expect when working and training in NHS Ayrshire Arran. In summary, we have excellent pre-registration tutors who will support you every step of the way. We offer a very varied timetable which trainees really enjoy. We provide a lot of opportunities to learn and develop your skills, and you will work as part of a large and friendly multidisciplinary team. And going forward, further education and training is encouraged and supported. Thank you very much for listening to this presentation. If you have any questions, please contact myself or Susan Stadden on the email addresses listed on this slide. And finally, I hope you consider applying for a pre-registration pharmacist place in NHS Ayrshire Arran, and I look forward to working with you in the near future.